Hi, and welcome to another edition of Hooked on Health, the show where we discuss and demonstrate ways to feel, function, and look your best. I'm your host, Brian Chambers. And we are not wasting any time today. We're getting right into the business of bodywork and discussion of the numerous benefits that come from it. My willing subject before me today was also the guest on our last episode of Hooked on Health, namely Miss Tiffany Seibert. You're going to wave at the folks at home, Tiffany. And she took me through a breath technique that I don't want to sound overly dramatic here, but it was life-changing. It was a breath technique that has left me, even as I speak, because we're going right into this next episode, from that one feeling more relaxed, more energized, looser, and just feeling really good. So I want to return that favor by doing a short session of bodywork on Tiffany that I'm really excited to be demonstrating this, because on the first 4 episodes of Hooked on Health, I was just talking about posture and the importance of posture for functioning properly. But I, by profession, have been doing bodywork along with personal training for many, many years, and used to demonstrate these techniques on Community Access TV. But this is the first time on Hooked on Health that I'm getting into it, so I'm excited. And the purpose of this really is to show people at home watching that these are simple techniques that you can practice on each other. And I'll talk about that as I go into it. But really the whole purpose today is kind of demystify what simple bodywork techniques are, so that you feel like you can really deliver great therapeutic work on people yourself. So we are going to start at Tiffany's head and neck. So as you can see, she's just laying on a large yoga mat, relaxing, which she's a ninja of relaxation. And that, again, this is simple stuff. What I've said to people for years is that everybody can deliver a really good therapeutic massage and bodywork session. The only difference between anybody and a professional is that we do it all day long. And that might not be everybody's cup of tea. But so what I'm doing here, I don't know if we can we get a close-up from the side? It's all right if we can't, but I'm just getting my fingertips, yeah. Super simple. I've got my fingertips, get down into, yeah. So simple, right, Tiff? Mm. So I've got, yeah, thank you. And I'm telling you, if you've never done this before, you could just try this with a loved one, family member, friend. Just ask them to lay down on the floor, put your hands underneath, and get your fingertips along the base. And don't really fret too much about whether you're doing it right or wrong. And already as I'm staying here, I can feel the muscles on the back of her neck letting go a little bit. And that's the essence of therapeutic touch, is that when it's done with that compassionate, present quality, it can only help. And so now I'm going to do a little bit more pulling. Again, don't worry about it. You're not going to break anybody's neck. Although this is a good time for me to offer my standard Hooked on Health disclaimer, all right? We are not medical doctors. I'm not a medical doctor, and I don't play one on TV. I don't know if anybody around here is old enough to remember that from some TV commercial. But seriously, all the information and techniques demonstrated and discussed on Hooked on Health are for informational purposes only and are not intended to diagnose, treat, prevent, or cure any disease. Having said that, everything that we discuss and demonstrate on Hooked on Health is science-backed and conservative. If you were to talk to a medical doctor or a personal trainer or a physical therapist, these are well-established techniques and modalities for reducing stress and improving function. So that's a constant mantra of mine about improving function. Because we don't really know what we're going to get in life, do we? And while we would all love to be completely free of pain and completely free of stress, that's not generally realistic for most of us. And so what we need to focus on is function. So wrapping that up, that's just, again, get behind the person on there, laying on their back, cup your hands under their head, and press your fingertips up into the base of the skull. Then we're going to do a little quick bit of facial work. Almost everybody likes this. Some people don't really like having their face touched, but I find about 95% of people do. And what's so awesome, if we can see this is so simple and awesome, is you stroke across the eyebrows, and then you go to the next segment of their forehead, stroke out to the side, next segment up, and you just go one sort of thumb-sized line at a time, up to the hairline. And then if you can see this, you do little circles right at the hairline, because for some reason we're just kind of more sensitive at that area, and the input feels good. Now, there's so many more things that you can do with the head neck therapeutic touch, but we're going to leave it at that for now, because I'm going to get up, and if you can follow me, we're going to go all the way down to the end, to the feet. Who doesn't love a foot rub? Raise your hands at home. Nobody? I don't see any hands going up. I always say there's two kinds of people in the world, those who love massage and those who think they don't. And they just haven't had the right one or something, I don't know. But feet, you can't go wrong. You cannot go wrong, right? So here, another simple and powerful technique for helping people is you just take their foot in both hands. I don't know if we're going to get a close-up here from camera 3 in a second, camera 1. But I've got my right hand across the top of her foot, my left hand under her heel and Achilles tendon, and then I'm leaning back. No big deal. Not yanking, not trying to pull her leg out of its socket, just leaning back. As long as we've got this up-close thing, we're going to go right into some footwork. So if we can stay there, most people know, I think most people know how to give a good foot rub. But again, it's just something that it really shows you care, right? And while as a professional, I want my clients to come to me, of course, but pretty much nobody has the time or the money to go get professional body work, you know, as often as they would like to, let alone every day. But even in this busy world that we live in, you can exchange with the people that you care about and the people you depend on for a little bit of TLC that's really effective. I see we're good, still on a close-up. So all I'm doing here is getting my thumb between the bones of the toes and working along it. Don't worry. And of course, the person that you're working on will probably bark at you if you do anything that hurts, but what I'm doing here is tracing along the back of the ankle. We're going to talk about anatomy for a second and about feet because it's fascinating to me. If you've also, I'm going to check the time because I'll get off on too many tangents. The foot. We go over to the other foot. Can we see this one? Because I think I'll probably be able to show it better. The arch. Did you ever wonder why you have that arch? I didn't know until I really started studying anatomy. I guess I just figured that's how your foot's shaped, right? That's how the bones are shaped. But that's not really so. It is an arch that is maintained by muscles. So what's fascinating is that it's like a stirrup. And I talked in the very first episode of Hooked on Health about the stirrup, the muscular stirrup that maintains the arch. We're going to talk about it again right now. There are two groups of muscles. One that comes down down this front of the shin and attaches at the top of the foot. So these muscles come down, attach to the bones on the top of the foot, and pull up. And then there's another group of muscles, or particularly a muscle called peroneus longus, that comes down the outside of the leg, behind the ankle, and goes under the foot and pulls up. So those two muscles together form a stirrup, like if you were riding a horse. And so I think you guys know what I'm getting at here, right? That it's this strap that lifts the bones of the foot, and that's what makes the arch. So what happens when you get flat feet and the arches drop? In part, it's because largely because those muscles have lost their ability to function properly. Now, I might be out of my depth here with orthopedic considerations, so I don't want to say anything incorrect, but I think that's roughly the scenario. And why do the muscles lose their ability? Because of a cuff of tissue that's around the ankle called the retinacular band. Here's where I don't want to get into too much anatomy, but there's a heavy, heavy, strong band of connective tissue that wraps all the way around the ankle and holds everything stable. But it gets tight, it gets locked down, and interferes with the muscles, because of course the power of the muscles is up here, and up here. So in other words, the muscles are up there pulling to try to form the arch, but by the time they get down to the bones where they're connected, they're getting interfered with by the retinacular band. So this is where I'm going to transition out of this segment today, is with really, every once in a while I say, if you never remember anything else that I said, try to remember this, because certain things are pearls, right? This is one of them. Friction massage on the retinacular band. And this obviously is something that you can do to yourself. And I recommend to everybody to do this to yourself if you can possibly remember, especially at bedtime. You sit down in your bed, ready to go to bed for the night. Just reach down and do 60 seconds even of brisk friction massage all the way around the ankle. And this warms, softens, and loosens the retinacular band so that the muscles that go underneath it can get back to doing their job of maintaining the arch of the foot. But it's nicer to have somebody do it for you. Is that right, Tiffany? I say self-massage techniques. It reminds me a little bit of dental floss, flossing your teeth. It's really, really good for you, but it's not actually very relaxing in and of itself. All right, quick segue into the next technique for the calf that most people, I think, can get this. You're just kneeling in front of the person, get your knee underneath their knee, and then slide back, and then push forward and slide back. And this can be intense. You'll just keep your eye on the person, because if their face goes, then it might be a little bit too much. The calf is what I call the perfect storm of muscles in the body, because it's so powerful. The calf muscle is really strong, and it's actually two separate muscles that overlap each other. And anywhere in the body that you have this combination of powerful muscles, a lot of force being transmitted, and overlapping muscles, and heavy connective tissue, that's the perfect storm for that. Like, so when if you press into somebody's calf muscle, it might startle them with how intense it is, especially right at that middle lower point. I think everybody almost intuitively knows what I'm talking about. But I think that's a good explanation of why, is because there's so much going on there. And that's really the miracle of the human body, in my opinion, is how well it actually works when there's so many vulnerabilities. You know, it really is amazing that we function as well as we do. But it's also a reminder to me of to try to not take things for granted. You know, most people, if they're lucky enough to be born healthy, they learn how to stand up, they learn how to walk, and years go by, and if they don't experience any significant injury, they don't even stop to think about why it is that everything works so great. But I think it's worth it to think, why do things work so well? And that gives you an appreciation for it, so you don't take it for granted. Okay, we've gone from the feet, head and neck, to the feet and calves, and now we're over to the hands. I don't know if we can get a wider shot. So just like who doesn't love a foot massage, who doesn't love having their hands rubbed? And in fact, if you only have a really limited amount of time to work on somebody, almost everybody wants their shoulders massaged because we carry so much stress in our shoulders, and that's natural. But what I've found over the years is that if you have a really limited amount of time to work on somebody, like if you're doing chair massage in an office setting, that you get possibly the best benefits of all, and lasting benefits, by working on someone's hands. And I think that might be because there's so many nerve endings, so the hands are so sensitive. It might be because we use our hands, obviously, so much. So our shoulders are just kind of there for most of us. Most of us are not doing heavy physical labor, although many of us are. So I don't mean to dismiss you super hardworking people out there exerting yourself all day. But if you're doing hard work, then no doubt your hands are probably taking the biggest punishment of all. So back to instructing a little bit of simple technique. Again, really straightforward. Hands on either side of the person's hand, and you spread. You spread. I'm spreading with this hand, spreading with this one, all the way across the palm. And then individual finger work. This can be fun, because I'm working down to the very tip of the thumb here, and then just giving a little pinch. Not a hard pinch, right? Again, it's in the quality of the touch. So it's a great way for you to check yourself. Like even with the person that you are closest to in the world, or if you have children, that it's an opportunity for you to check in really with how you're feeling at the same time that it seems like your focus is on how they're feeling. But of course, it's this circuit that gets set up between the person giving the work and the person receiving the work. And so it's an opportunity for you to slow down and really check in with what you're feeling at the same time that you're helping the other person. Here, I don't know if you can see it on the camera. I'll raise up a little bit. We can go back to that last camera shot because this is great. This is another example of something that is really pretty sophisticated in terms of its effect on the tissue, but the technique itself is just simple. So I'm starting at the wrist. There you go, Tiff. Yeah, she's going to let go. Here's a good side note. Her arm started to get sort of a little bit stiffer. She was helping by holding her arm. That's a very natural human tendency, but my goal is to have the person letting go. So now, if you follow my thumb, I don't know if you can you bring that camera angle down? Beautiful, follow that down. I am just plowing through, that sounds kind of harsh, but plowing through with compassion. That it's that firm, authoritative pressure down just past the elbow. Super useful. Like, you don't have to really know. If we can get a wide shot here. You don't really have to know exact anatomy to already intuitively know the placement of the muscles. Think about it. Muscles are there to move joints, right? So the muscle has to cross over the joint. So if you think about the muscles that are below the elbow, they don't end until they're above the elbow, if their job is to rotate or bend the arm. So what I mean is that ideally, when you're at a basic level, when you're working on somebody's muscles to help relieve their muscle tension, push the whole length of the muscle, at least part of the time. Doesn't mean that it always has to be that way, but make sure that you practice that. So these forearm muscles that everybody is tight from working on the computer, texting on their phone, driving, right? Just go from a little bit below the wrist and then all the way along to a little bit above the elbow. All right. Camera, can we get a time check back in the real world of how many minutes we have? Because I'm going to determine what we're going to do. 5? 21 minutes in? We got a few minutes left. So, I know what we're going to do. Can you roll over for us, Tiffany? We were going to do, this is typical. I get off on my soapbox about stuff. So we were going to do a more in-depth session with her face down because, as I was just saying, the back work is so much. So here, this is more really good stuff, really simple. Yeah, I think here, 3 or 4. So this isn't ideal because I normally use some supportive cushions on the floor, and normally the person would have a face cradle, but you're going to get the idea anyway. And you're okay, right, yeah. Tiff? Okay, she's okay because her head is turned to the side, obviously. So basic stuff also. Your friend, family member, loved one is laying face down. You can kneel at their head, presuming that your knees will allow you to do that. And now I'm not doing anything right now except leaning in a little bit. And I'm sure for most of you that I'm talking to, this isn't anything really new, that you've probably done it yourself. It's just I feel like it's one of my callings in life, is just to remind people that everybody can do it. And I'm just leaning in a little bit, and now I'm just walking my hands down like a cat. Does anybody have a cat at home when they knead on your leg, on your lap? And now I'm at the hip crest, and I'm just leaning in, getting a little bit more of my body weight. And you just hold that for the count of a few breaths. And then walking it back up. So again, it's great if you can get an hour's worth of body work or an hour and a half, but every little bit helps. And so if you feel like you don't have time to help somebody out, realize we could be just talking about a few minutes. So before I wrap up today, pardon me 1 second. This is where I'm really switching into professional mode because I'm feeling this. Can you turn your head the other direction without any pain? Yeah. Yeah, go like that. Good. Good. Okay. So my guest today, who has been so cooperative with me and generous to receive this work, Ms. Tiffany Seibert, who is the founder of COP2 Yoga Peace Force, which was the subject of our last episode. I just again want to thank her, and really thank her on behalf of the city of Chicago. Remarkable. And I hope that everybody who's watching this episode can also keep their eye out for the previous episode. And also, I'm glad I just remembered this because I'm terrible at self-promotion. But my name's Brian Chambers, and if you go to YouTube and search for Hooked on Health, you're going to get my YouTube channel, and I would certainly love it if you would subscribe to it, and you'll be able to see this episode and other episodes and future episodes, which are going to include a lot more of this therapeutic body work. We're going to have some of Chicago's very best therapists on demonstrating, along with a lot of other subjects. So until next time, this is your host, Brian Chambers, reminding you to get hooked and stay hooked on health. Thanks, everybody. Bye-bye for now.